Hey viewers, welcome to Humanity Chats. This is Margie, your host. We get together and do this every Thursday. We talk about everyday issues that impact humans. Thank you for joining us. If you're here, tell your friends. We just had the first part with Susie Cole, who was a lawyer for nonprofits. We had a wonderful conversation. She told us. She told these nonprofits how to find loans out there, gave some fundraising ideas. And we are going to have a wonderful lady from Michigan with us today. She's a doctor and she is a mental health expert. So without much further ado, we are going to bring in our speaker for tonight, Dr. Dayna. If you're here, drop it in the chat room. Let's see where you're watching from. Thanks to our YouTube viewers, our Facebook viewers, podcast listeners. Thank you once again. 17 countries. Oh my goodness. We really appreciate you guys. And so without much further ado, we are going to be bringing our guest in soon.
Hi.
Hey. Hi, Dr. Dayna. It is so good to see you.
Thank you. Thank you so much for having me. I'm so excited to be here.
Well, I must confess, you do look really good in red.
Oh, thank you. I appreciate it. Thank you.
Well, before we get started, I would like to ask you to share 3 fun facts about yourself.
Oh boy. Okay. 3 fun facts. Fun facts. So, okay, let's think about fun facts. So number 1, I would say I love cupcakes. Cupcakes are fun. I feel like that's a fun little fact about me. I used to ice skate back in the day. Some people are kind of surprised to hear about that. And I still love ice skating, although I haven't been able to go lately. Fun facts. Also, I guess a big thing for me in 2021 is just trying to have more fun with reading. So if you guys have any recommendations for like fun books to read, not like books for work, but like more fun, I'm excited to learn about that this year. So I don't know. That's my best shot at fun facts.
Well, Dr. Dayna, since you mentioned about books to read, I am an author.
Yes. That's all. We got to do. That's on my list.
Yeah. So you got to read The Shimmer Grant and you got to read Same Elephants. Those are the best books in the whole entire universe.
I believe you. I'm on it. And then we'll reconnect and talk about it.
Yes. How about that? Would be awesome. That would be awesome. Well, viewers, listeners, it is good to have you back on Humanity Chats. Please share this with your friends on Facebook, YouTube. Dr. Dayna is going to give us some important nuggets, especially during these COVID-19 times where we're struggling. It really doesn't matter whether you're rich or poor, old or young. Your mental health, it's really important. And so it is great to have Dr. Dayna with us with the wealth of information that she has. We're going to talk about mental health in the age of COVID-19. Dr. Dayna, could you just give us a brief overview of what mental health really is?
It's all about, first, I think it's important to know, I feel like mental health and our physical health are all connected, right? If we don't have good mental health, it's connected to the rest of our health. But it's all about what's happening in our mind and our brain. It's related to depression, anxiety, other disorders like bipolar or schizophrenia. but just making sure that, we take care of ourselves both mentally and physically. They're all connected.
Yeah, thank you.
Yeah.
Because and I can say that I can attest to that because there are times that maybe you may go for a walk and feel a little bit better.
Oh yeah. Oh yeah. Oh yeah, it's all connected. I mean, even, when I think about how to cope and how to deal with everything, exercise is one of the things that I recommend. So I'm a psychiatrist, right? Like, people are coming to me to get help for depression or anxiety or some other mental health disorder. But, so I may give, because of my role as a psychiatrist, I may give a medicine, but on top of that, guess what? I may tell people, get into therapy. I may tell people, get some exercise in. We may talk about sleep and other recommendations. So it's more than just the medicine.
Yeah, more than just medicine. Now that brings me to the first question:
Sure.
quarantine. Dr. Dana,
Yeah. Let's
it,
talk
you
about
know, it's so easy for people to say quarantine, or sometimes, you just comment on TV and say, stay home, we're in this together. And sometimes I look at people and I'm like, no, we're not in this together. Um, you know, we have folks that are homeless. We have folks that are, big families living under one roof, and we're not in this together. Everybody is fighting their own battle.
it.
Can you tell us, give us some pointers on how to cope with quarantine, what
Yeah.
it does to us, how we can get better at it?
Yeah, yeah, I can. And I remember when I was in training and I was in residency, one of my teachers talked about the three R's. So whenever there's uncertainty or stress, I feel like it's really important to think about the three R's. So the three R's are reassure. So when I think about reassure, that means, look, let's acknowledge this is hard, and it's okay to acknowledge that, but to reassure ourselves that we'll get through it. So reassure, regulate, and the last one is routine. So reassure, regulate. Regulate, how can we regulate our emotions? How can we deal with our emotions in a healthy way? Everyone will do that in a different way. Some people may use breathing techniques. A very popular topic nowadays, and that's very valuable, is mindfulness. Learning how to be mindful throughout your day. Some people may use music, or using their five senses is another skill that a lot of people may like kind of engage in to help with regulating themselves and regulating their mood. So figuring it out, we talked about exercise already a little bit. So exercise. And then the last part is routine, just making sure that you stick to you stick to having regular routines, but we also make sure that we include the really important elements of our day. So not forgetting about sleep, not forgetting to make sure we eat and do the basic things that are so important for our overall health. Um, so that's just like a really easy way to think about how to cope, is just to think about those three R's.
Wow, the three R's: reassure, regulate, and routine.
Right. Right.
It this is important because my next question to you is actually about routine, having a schedule or going with the flow.
hmm hmm That's a really good question, actually, because I kind of think both are important. So first of all, in general, I just think it's really important to have a routine. We all thrive with a routine. Kids thrive with routines. Adults, we thrive with routines. I think having a routine is really important. There's benefits to having like a regular routine to your day. But I also just wanted, and I think we talk a lot about routines like in various settings, but I wanted to highlight it's important to not let a routine overwhelm you. So just being careful about that. If the routines are starting to kind of get in the way or stress you out, then maybe you do need to take a step back and kind of go with the flow. And I think there's nothing wrong with going with the flow. And I wanted to say, sometimes you can have both, right? Like both can be present. You can kind of go with the flow, but still have some routines. Oftentimes I'm a child and adolescent psychiatrist, so but I still see adults too. So I still work with a lot of adults. But routine is something that pops up a lot when we're talking about children, because we know that when there's a regular routine in place, it really helps kids to develop self-regulation skills. And that is so key. So I always talk to families about trying their best to have some sort of morning routine or evening routine, or a dinner routine can be a lot of fun for families, and really letting kids take part in those routines. And also, I would say it can be a special relationship bonding moment with families. So adults, we need to take care of ourselves, but also when I was thinking about kids, making sure we build in routines for all of us.
Well, that is um, I I realize that I thrive when I have a routine,
Yeah.
but at the same time, there are days that I just want to go with the flow.
And that's okay. Yeah, it's all okay. I think what's most important is that we all figure out what works best for us, and each person is different, and our needs are different, and the stressors that we have are different, right? And so figuring out what works best for each of us, that's what's most important.
Yeah, it is important. Um, and I've said the word "it's important" so many times. Viewers, listeners, please bear with me. Please bear with me. Because I realize that sometimes even waking up at the same time each morning
Yeah.
helps me to plan my day.
Oh yeah. Well, and so when we think about routine, or just about your overall health, I think having a regular wake up time and going to bed time is key. It's key. And so oftentimes when people have, if they struggle with sleep, that's sometimes where we'll start. We'll just be like, okay, let's try to figure out a regular sleep routine for you, and trying our best to have a regular schedule. I mean, and that's how our bodies are built anyway. It's used to having that type of schedule. So yeah, waking up at a certain time as best you can, getting, I don't know, for me at least, getting my day started in the right way. And everyone's different, what's important to them and what they value. And then I'm a to-do list person, but you can't let those things overwhelm you either. That can be overwhelming, but I like to have my to-do list. That's kind of something I really enjoy and I thrive off of, and just keeping it moving with your day.
Yes, yes, keeping it moving. Now, I think we're going to go to the chat room to see what our viewers are saying. We have Loretta Diligeri saying she loves the 3 hours. Yes, yes, yes. And then we have a viewer watching from New York City, um, Angela. And then we have another one, Mommy, watching from Wisconsin. So, and she is loving the red on you. So,
Thank you.
yes, yes. You have people from all over, and thank you so much for joining us from Michigan.
Yes, Michigan. Yay.
Now
Yeah,
that,
no problem.
oh, please go ahead.
Oh, I said no problem. I'm really happy to be here. I'm really happy to be here.
Well, that brings me to the next question. We've talked about routine scheduling and going with the flow, and you are a child adolescent psychiatrist.
Mhm.
Now, these kids, their physical health.
Mhm.
Can we talk a little bit about that? Can you tell us about some of the stresses, even social media behavior? Can you tell us what to watch out for and how to advise our kids?
Wow, yeah, there's a lot there. Let's talk about it a little bit. So, number one, I do think it's important for all kids, even though we're in quarantine and we're trying our best to stay safe. So you got to stay safe, obviously, but it's so important to get moving. So even if it's cold, I was just talking to a friend about, I just bought a sled because I don't even like the cold, but I'm trying to embrace it. So if you're living a cold environment, it's okay. Still try our best to get the kids out there, get moving, get going, get their heart pumping. There's data that talks about the value of exercise in mental health. They're connected. So, sometimes I will tell families, look, let's try to get exercise. Let's get the kids heart pumping at least 30 minutes. 3 times a week. We'll just start there. Just kind of, and it doesn't have to be anything hardcore, but I think getting outside as best we can, bundle up if it's cold, and get moving and go for walks, or embrace something outside in a safe way. And there's also ways to get exercise inside, but I think it's much easier to do that outside. So in general, it's just very important to move and get exercise in. I think that's really important for kids. I think another thing that you mentioned, social media. I think screen time is a big topic nowadays. And there's a lot of mixed kind of reviews about how to think about it, or what to think about it. In general, I would say we should try our best to limit screen time if we can. But I'm going to be honest, we're living in a hard time right now, right? Like, things are different. And so I think we have to be kind to ourselves as parents. And it's okay if the screen time is maybe a little bit more than usual. But I think what's most important about screen time and social media is that it's quality content that our kids are seeing and looking at. So making sure, if they're getting some screen time in, making sure it's quality stuff, quality programming, or they're learning something from it, or that it's not extremely violent. I think that's a really important thing to think about, is the quality of what they're seeing. Social media is a whole other beast, especially for older kids. We have to be careful about that. But right now, the older kids, so this is like a whole other topic, but it's related. The older kids are really struggling with connection right now. Like, you have to somehow, if some schools are open and some schools aren't, but the ones that are not actively physically going to school, I think it is important to have a balance. So it's okay to have social media and to have ways to connect with peers. And I think that can be a unique way for us to help adults and kids connect with people in a safe way. So I think that's a good thing, but there has to be a balance. And sometimes I do think that some kids and adults too are going overboard with it. So we got to find balance. And I think it's fun. I think COVID is giving us a chance to get a little creative. Like, let's think about other things we can do besides the screen. What did we do back in the day when we didn't have all these screens? And so trying to think creatively with your family about other things to do other than the screen, I think, is important.
Well, Dr. Dayna, talking about social media, it actually brings me to my next question, which is handling isolation.
Yes.
Because although these kids may be on social media, people are feeling more alone. I
Yeah.
mean, you would go on social media, and even though there is quarantine or there is social distancing, you would see that a bunch of your friends are at a party. You did not get invited, and you're probably supposed to stay at home, and you feel left out. How are we supposed to handle this isolation? I mean, and some of these kids are in virtual school and they don't even have any connections, or they're kids that have started entirely different schools,
Yeah.
but because of COVID-19, they're in new schools without connections, without friends. How are we
It's
supposed to
hard.
handle isolation?
Yeah, that's a really good, I mean, it's a really good question. I think it's really hard, but I think we all have to be very intentional about trying to connect and being, again, it's an opportunity in some ways. Anytime there's a challenge, I feel like the best thing for us to do is to try to find the silver lining in the midst of that challenge. And so I think in some ways, this is an opportunity for us to really think about how to address this isolation, even in the midst of having social media accounts. So, and you're absolutely right. Like, I think you can still feel very isolated and alone with a social media account. So I would say try to be very intentional about connecting one-on-one with friends and family, in a safe way. I recently did a vision board party with a friend over Zoom. It wasn't the same. We usually meet in person. It wasn't exactly the same, but we made the best of it. And you know what? That hour and a half of time together working on our visions for the year was fun. I haven't seen them. I haven't seen them since this whole quarantine thing went down, right? I know some friends, we also did a little Jeopardy game online, and that was so much fun. It was just a little kind of quiz with friends and family. So that was a lot of fun. So you have to kind of get creative, but be intentional. Be intentional about making that one-on-one real connection with people. I think that's That's so key. And even with my little one, so it's hard. I have a 3-year-old. Okay, she wants to see her friend. She has this best friend, and she always wants to go over there. But because of COVID, we're being very cautious, right? And appropriately so. So we're on FaceTime, and we'll do a story time together. The other mom will have her a book, and then I'll have a book. And it's sometimes a little chaotic because they're three, but you make the best of it. And it was fun to connect with that other mom. And then it was fun for her to see her friend. They ended up, the book was very short. They ended up doing other things together. But my point is, I think we can do it. It's just all about being intentional.
Now, thank you for sharing. Do you think that teenagers can do it too? They can do these Zoom parties. Um,
I
is it
do. I do. I do. Of course, certain folks, some people do create their bubbles, so I understand how some families have like other families or other friends that they feel safe with, and they're both, so everyone has to make their own individual decision around that. Some people feel very comfortable kind of being around other people, some people don't. So every individual should make their own decision around what they feel, comfortable with in the midst of these hard times, but yeah, I do think that we could use social, like the virtual platforms, and there's so many of them. We can use those with teens. And I also think if you feel safe and you can do it in a safe way, you can meet with friends. I've heard of some of my teen patients meeting with friends outside, wearing masks, going for walks. Or some of my teen patients just have their own little bubble of friends, and their families are all staying safe and connected, So, you just kind of have to figure out what works for you and your family.
Well, staying safe and connected, that's the key. Now we're going to the chat room. We have Janet saying this is a brilliant idea. She loves this. And Rosie said that the vision board party, wow, that sounds like a good thing.
Yes, I
Yes.
love vision boards. I think that's just a whole other topic, but that's like a fun thing that I do every top of the year.
Yes, Loretta is saying it's great advice on social media. It must be a balance. I mean, even for adults, like you would see somebody's social media and you're like, oh, wow, they have all these friends. They got together. And it's like, there are days that I will pick up my phone and check my messages, and I'll have group messages for like the groups that I belong to. But
Mhm.
like a personal message from somebody just to say, hey, Margie, how are you? I'd be like, oh, nobody thought about me, And I am an adult, and on the outside, I look like I'm even popular. So I can imagine how hard it is
Yeah.
for others who may not even have the network that I have.
Yeah. Yeah. Well, so a few thoughts about that. I think number one, we all need to just have so much love for ourselves that we're not dependent necessarily on social media or other people's highlight wheels to like make us feel good or bad about ourselves. And so in general, all of us being kind to ourselves, being more kind to ourselves, and just knowing that you have self-worth. It doesn't matter, the social media shouldn't have that much power over us. Even though I totally get what people, that whole experience, but in general, we all need to just own our own like self-love, right? The other piece that you mentioned, and I'm drawing a blank now what I was thinking, but I think in general, I guess I'll go back to my first point. Don't let them, being intentional, that's what it was. So being intentional, so even though you kind of have to be a friend to have a friend. So I sometimes don't have messages either, and I just get so overwhelmed with life. Welcome to life, right? That's how it is. So the other thought you made me think of when you brought that up was sometimes we just send the message to the friends, and then that you never know what your friends are going through too. So when I feel that way, I end up like maybe texting a friend or sending a personal message to them, and then the messages start coming in. So those, you kind of sparked those two thoughts in my mind.
Well, viewers, you heard that. These are really different times. And if you miss someone, reach out. Or if you haven't heard from somebody, reach out to the person. Don't just go like maybe the person's picture and ask how they're doing, because those those connections have to be intentional. Now, Angie is saying learning about the creative ways to maintain relationships for our children during the COVID. Great information.
Yeah. Yeah. Relationships are so important.
Yes, yes.
And I would say too, like parents maintaining our relationships with our children. This is a great opportunity for all of us to build more connection and better connection with our children. I think sometimes we get overwhelmed with our own to-do list and our phones. And so being intentional about our connection with our kids, I think that's important.
Well, being intentional seems to be the key. Now, so soon our time is almost up. I don't even know what happened because
Time flies.
yeah, it's like we started talking 5 minutes ago, and now it's almost time for us to wrap up. What are some morale boosting tips that you can share with us?
Morale boosting tips. That's a really good question. I would say, you know what? This too shall pass. We got this. You know, we have we have the power to overcome this tough time. And I think it's really great right now for us to create our stories, and so think about our values and what is our story going to be when we look back over 2020 and 2021. So being intentional about creating an awesome story for yourself and for your family.
That is great advice. Because, sometimes we tend to focus on the negatives, but
Oh,
we,
yes.
yeah,
And I think it can be very easy to do that when there's so many negatives. It can be really easy. And I mean, like I said earlier, I think it's good to acknowledge this is a hard time. One way that I really cope with that is gratitude. So being very intentional about gratitude, and there's data about that too. So just being grateful and maybe building that into your routine. Gratitude.
gratitude. Yes. Every morning, to tell you the truth, every morning when I wake up, I lay in bed for a little bit longer and I thank Jesus,
Yes,
because I'm like, okay, I don't have a headache. I think I don't have any joint pains. Thank you, Jesus,
you're
for
you're
what you've
alive.
given me. And then I thank God for my family. Just practice that gratefulness. And even when I'm about to eat and it's not what I would have wanted to eat, I think about the fact that somebody somewhere is hungry, you know.
Right. Right.
Or my book came out last year. I had all these high hopes for the book, and I was going on tour and da da da, and things didn't go as planned. But I said, okay, I got to thank God that I have a roof over my head. You know, everything cannot be perfect. So, hey, viewers, listeners, let us try and look at the glass half full. I know that that's tough because there are times that we want to see it as half empty. I swear. And I have this friend, Selom. She lives in Ghana, West Africa. And she says that, well, if you think your glass is half empty, then get a smaller cup.
I love it.
Yeah, sell them. She says get a smaller cup. So yeah, maybe if you can't do the half full thing, get a smaller cup.
The smaller cup.
Yes, yes, Dr. Dana. I see that we still have some more comments that came up. Well, we have people clapping for you.
Oh,
Um,
thank you.
yes, Lydia said this is great. It's a great chat. Thank you. And I guess this was in response to something that she said. Oh, yes, Rosamond. She said she even learned to be thankful for snow. What do you
Love it.
mean? Yeah, but,
Go for it.
but Rosamond, we love snow. So to be thankful for snow is like, you got to be thankful.
Love it.
Now,
Love it.
people in the South, 'cause I'm in South Carolina, people in the South always wish that they would get a little bit of snow. And then
Mhm.
people who live up north or, where they get a lot of snow, they complain because then they have to shovel the snow or, yeah. So I guess depending on where you live, you might have a complaint.
Yep.
Yeah, so I did get some really good tips from you, viewers, concerning our mental health. Dr. Dana told us about the 3 R's: reassure, regulate, and the importance of a routine. She wanted us to practice mindfulness. She talked about music and exercise, how music can boost your spirits. And I
Absolutely.
don't know about your religion, but hey, if you're a Christian and you want to get your praise on, it's always good to listen to some Kirk Franklin or,
Love
some
Turkey.
popping music. Yeah, and if you want to listen to Jay-Z, if that's what's going to get you moving, or Michael Jackson, whatever you listen to, it's good. Get moving because that exercise is important. Dr. Dana does not want the routines to overwhelm us. So I know there's some people who may be even a little bit OCD and may not be able to help it. But let's make sure that those routines do not overwhelm us. And, she said exercise is good for our mental health. And so it is very important for us to get moving. She touched on social media. Um, don't let the hype get to you. Um, right?
Absolutely. Yeah.
Yes, yes. And one of the most important things she said was to be intentional about connecting. So, if you haven't heard from someone, maybe you should also reach out to someone. And let's not be superficial in the ways that we connect with each other. And there's safe ways to do it. She gave us examples of, having these Zoom parties. I know that I have this cousin that you know, sometimes we play music. We like to play Afro beats.
Yes.
Yes, yes. Why you do me like Joanna?
Yeah.
You know?
I love
When,
it.
yeah, so we'll be on Zoom and we will just be going, do me like Joanna and boogieing down. She's in Maryland, I'm in South Carolina, but we do it and we keep each other company. Hey, you can play culture tags. I don't know if you know what culture tags is.
I don't.
Oh, you don't, Dr. Dana? It's a new game. Google it.
Okay.
Um, so we had culture tags on Zoom one time,
Oh,
and
that's fun.
and what we did was we used hashtags. So like LOL, and someone was supposed to guess what that was. But what we did was, I'm originally from Ghana, so we used Ghanaian culture tags,
Oh,
and
cute.
yes, and so like maybe may thunder struck you, fire burn you, stuff like that that um African parents
Yeah, yeah, yeah.
that African parents say, and we use those as the acronyms. And so,
I
my
know exactly what you're talking about now. Yeah.
they put it there. It's like I something, and then I don't know where they came up with the stuff, but like in Jesus' name,
Yeah.
or stuff like that.
That's fun. That's
Yes.
fun.
Yes. So, look, I am so grateful for all the advice that you have given to us.
Yeah.
And yes, I wish we could talk for longer. I have loved this conversation. Viewers, this conversation is going to be on our podcast, Humanity Chats with Margie. It's on YouTube, it's on Facebook. Share this. My spirits have been lifted up just by talking to Dr. Dana. She has a wealth of information to share, and at this time, I believe that she probably has some nuggets to wrap up. And so I will remove myself from the screen so that you can give us your best educational session for our mental health.
Okay, sure, sure. I guess for mental health, what's most important, I think, is do the things that you can do to take care of yourself. So whether having a routine, doing self-care, getting good sleep, exercise, having good nutrition is something we didn't talk about that much today, but nutrition is very important. But on top of that too, if you're feeling overwhelmed and if that's not enough, it's okay to ask for help. And I think that's the biggest thing that I want to communicate as we wrap up today is it's okay to ask for help. And if you need to talk to a therapist or a psychiatrist, it's okay. Let's normalize, getting help for our mental health. Let's normalize therapy. It's okay to get therapy and for us to gain skills to help us navigate this world. So please don't hesitate to ask for help if you're feeling overwhelmed.
Wow, thank you. That is so important to ask for help. As people of color, I think that asking for help doesn't come naturally to us. We would like to keep it in, or
Yeah.
sometimes just to pray it away.
Absolutely. And I think prayer is important. So go ahead and pray. If that's really important to you, I support that 100%. Or if you have whatever faith or religion you believe in, I support that. But, sometimes on top of the prayer, it's okay to talk to your doctor about what's going on and getting evidence-based care for what you're going through. So when I say evidence-based, what's the research say about how to treat depression and anxiety? And I think most doctors out there are okay with religion and faith, but sometimes you may need to take a medicine or you may need to go to therapy, and it's okay.
You know what, Dr. Dana? You are amazing.
Oh, thank you.
Yes,
You're amazing.
evidence based. That's the thing.
Yeah,
Because, I think that some people just don't understand depression and
yeah,
they're like, why are you sad? What's wrong with you?
yeah, yeah,
You got clothes. Or like when teenagers are sad, sometimes adults don't even understand.
yeah,
But you nailed it on the head. Sometimes they may need medicine or they may need somebody to talk to.
yep, yep.
So thank you. Thank you so much for sharing that. Now, do you know of any resources that people could use that they could find out there?
Yeah, that's a really good question. So, um, most local counties and states will have access, like places to go or numbers to call if you need to get care. So I would say look at your local county mental health network and or your state, wherever you live. If you're out of the country, I think most public, like um, big public like locations will have a mental health authority of some sort to go to for care. So I wanted to say that's important. If you're in the States, NAMI, NAMI, National Alliance for Mental Health, they're a great resource. Um, and I would go to their website. They also have a number you can text, and you can just text that number, and they will give you. And it's easy to find on Google or wherever. But look up NAMI, and NAMI will also give you resources about what's local. So I think that's another great resource. Online, there's tons of other resources too. Within the Black community, there's some great therapy options. Some people say they only want like a Black therapist, for example. So I would say go online to look for those resources. And then I would also say, in the day of COVID, there's a lot of telehealth resources. And even if there's limited funds available, unfortunately, sometimes mental health is not always covered. A lot of therapists and psychiatrists will have sliding scales. So ask. I say don't hesitate to ask if there's a financial burden of some sort, and they will make adjustments. Some people will make adjustments if they can.
Wow. Thank you. This conversation has been so good and beneficial. I cannot wait to share it with my network. And you have received all these positive. Amma said thanks. Angie says thank you so much. Doc, Janet is saying be intentional about connecting. So important, especially in these lockdown times.
Yeah.
Yes, because people are lonely. Thank you so much, Dr. Dana. You may have saved a life or two tonight. And for that, you richly be blessed.
Thank you. And thank you for having me. I appreciate it. This has been a lot of fun.
Well, thank you. Viewers, we went over our 30 minutes, but I guess you didn't feel it. Um, that's, that's the advantage for our second speaker, that sometimes they're able to go over the 30 minutes. Thank you so much once again for joining us on Humanity
Yeah.
Chat. If you liked this, please subscribe to Margie TV on YouTube. Follow us on Facebook. And Humanity Chats with Margie is on all major podcasts. Find us. You may not be able to watch. You can listen when you're on a walk. And you know what? Shoot us a review. Let other people know about us. Because if you're like me, when I'm going to buy a product, I want to know what other people are saying to know if the product is good. And so please look it up. Um, give me that 5 star, or better still, you can say that Dr. Dana's conversation was really impactful. Our speakers go out of their way to give us resources, and these resources are given to us free of charge from our speakers. And so please, follow us. Next week we're gonna kick off Black History Month. Ha! I am so excited about the opportunities for next week. We have Ghana's foremost publisher, La Public Press, Nana Ari Damwa, who is going to be our first guest. Um, it is going to be amazing. We're going to learn about books written by people of color all around the world. And then we're going to have this beautiful family out of South Carolina. This young girl, her name is Gabby Goodwin. She is the founder of Gabby Bros. And she's coming on with her family. She was just featured in Black Enterprise. Her parents bought her a house as her headquarters. And so join us to watch the Goodwin family. It is going to be inspirational. It is going to be uplifting as we kick off Black History Month and the whole month lineup. Oh my goodness, you would not want to miss the Black excellence, the Black girl magic, the brown boy joy, all that we're going to have next month. And we welcome all our guests from every walk of life. We are all humans. So, no matter which race you belong to, join us. We are celebrating Black history and we want you to know about it. We want you to see the joy, we want you to see the accomplishments, and we want you to hear some of our heartfelt stories because it's not all joy. Sometimes there is pain. I look forward to seeing you all next week. From Dr. Dayna and myself, we say a big thank you for tuning in to Humanity Chats. We are very grateful to you all. We thank our sponsors, Spartanburg Nephrology Associates. We thank our support staff. We thank everybody. We thank Andrea Bisley. Oh my goodness, that woman is phenomenal. She bends over backwards. Thank you so much, everyone. And we look forward to seeing you again next week. Bye.